Friends, we are initiating this Friday's Time with Thebsian. The topic is on medical devices. Today we will be discussing about the artificial heart valve to replace the original defective heart valve of the body. When during the medieval period and the ancient time man became sick, we have organized or learned techniques to overcome various diseases and deficiencies, and how to overcome broken legs, broken hands, etc. As medicine progressed, man found out that when heart ailments affect the organ due to defects in the valve or loss of pressure in the pumping system, he devised various methods to overcome that. So, he designed artificial valves to replace defective valves and accessories to assist the artificial valve. Artificial valve was found to carry out the function of the original heart valve effectively, but in the initial stages of the development of the heart valve, there were deficiencies in the function of the artificial valve. Very soon, physicians and engineers together started correcting the deficiencies in the artificial valve to give a satisfactorily functioning artificial valve for the human being so that he can go back to the normal life, work and support the family with the income from the work. There are two types of valves in the beginning: mechanical valves and prosthetic tissue valves. Mechanical valves, as we have seen earlier, were made up of metals, plastics, cloths, swing, thread, and the tissue valves were made from tissue saved from human beings and animals. Animals means especially from cows and pigs. In the case of mechanical valves, the first valve was a caged ball valve, and the second valve was a single leaflet valve, and most modern is the bi-leaflet valve. Mechanical valves, especially the leaflet, bi-leaflet or single leaflet valves, were made of a metallic ring with two struts on two sides to keep the fluttering or the valve disc in place and to sew this ring into the valve tissue to the wall of the heart. And to make sewing possible, the metallic ring was covered with polyester cloth or a nylon cloth so that it can be safely sewed in. But as you know, the various foreign materials, when in contact with blood, they may clot the blood or break the blood cells in that, especially the red blood cells, causing hemolysis. Tissue valves use tissues saved from human beings or valves of pigs and calves fixed on metallic rings as a base for fitting the valve so that it can be sewed into the heart tissue in place. Bovine and porcine tissues are very commonly used. Mechanical valves may last for a lifetime, whereas the tissue valves may last only 5 to 6 years, depending upon the age of implantation of the valve. The first valve was a sutureless valve designed by Professor Hofnagel, but this valve could not be placed in the position of the heart valve, but a little bit away from that in the aorta. So though patient was able to recover and move to active life, but he was not fully benefited by the valve surgery. There was some kind of a leaking or regurgitation when using Hofnagel valve. This valve was implanted in 1952 and it was implanted in a 30-year-old woman in the first place. Along with Hofnagel, Dr. Harvey was also responsible for initiating artificial valve surgery mechanisms. However, heart valve replacement became a standard practice in 1960 by the invention of Dr. Harkin and Dr. Albert Starr. Dr. Starr has a valve in his name also. The mechanical valves became little more design worthy and functional when plastic components were added to the valve. The first valve was a cage where a plastic ball was opening and closing. This valve made lot of noise. Somebody who were implanted with a ball valve was always troubled with the noise the valve makes inside his chest. So in the beginning, the patients used to keep table fans or a pedestal fans near him so that he or the people who are working with him will not hear the lub-dub noise of the heart valve. Tilting disc valves were introduced in 1960 and there were a lot of designs. Bivalves were there, single valves were there, single valves protected by struts were there. But in the beginning, the breaking of struts were one of the reasons why lot of time and effort was spent on designing the struts, especially welding the struts into the cage of the heart valve. But the inception or design of these valves reduced drastically the amount of blood damage or red blood cell damage, and it reduced the dose of the medicines that have to be used after implantation of an artificial valve. Artificial valves usually use titanium as a cage ring, and during the last 10 years various alloys are being used. Vitalium is being used for the ring and struts, and as far as the valve, whether it is bivalve or single valve, pyrolytic carbon is the main material used, even though high molecular density, high density polyethylene is also being used by some companies to make the leaflet, single leaflet or bi-leaflet. Tissue valves are called bioprosthetic valves, and they are actually made from the calf tissue or porcine tissue, and porcine tissues are used in large number because it is more biocompatible when compared to calf tissues. And these tissues are used only after neutralization for immunological responses, to prevent immunological neutralization procedure to prevent immunological response from the host body. And when we talk about heart valves, it is very simple to say that is the case about heart valve or a bi-leaflet or a single leaflet valves. They will serve you lifelong period of service, but the science, engineering science and the medical science, the required for the production and maintenance of an artificial valve is very much enormous, and we are thankful to the people who have the idea to design and work to face the problems that came up along with the design, fabrication and manufacture of these heart valves. So friends, this week's Times with Thebsian is ending here. Kindly see you all next Friday with another topic. There is a Malayalam version of this topic also aired today itself.